Objection.
Thank you, Mr. Speaker. Mr. Speaker, 3 years ago, the Democrats told the American people that Congress had to pass the Obamacare Act so that we could learn what was in it. Well, 3 years later, we're just now learning what really is in the law and how it will cost Americans jobs and limit their health care choices. It's no surprise to me that the administration has delayed the implementation of the employer mandate. Just as every honest observer said it would, Obamacare is costing Americans full-time jobs and wages as employers prepare to comply with the new mandates spawned by this law. Later today, the House of Representatives will vote to delay imposing Obamacare's crushing burdens on employers. For once, we agree with the President. This law cannot be implemented without significantly harming our economy. We will also go one step further and delay these same burdens from falling on the backs of individuals as well. I don't believe it's appropriate to protect one half of America from Obamacare, but not the other half. We will give the American families the same reprieve from this law that the Obama administration is promising to employers. The two votes we are taking today are important steps toward repeal. All of the regulations required by this law are still not written. With every day that passes, a new regulation is announced, revealing just a little more of what this bill will actually do. Each rule and regulation mandates new costs for employers, more restrictions for the insured, and ultimately hikes the cost of health insurance for American families. This law is not ready to be implemented. There are too many questions, too many inconsistencies, and too many complications. Despite the promises of the Democrat leadership, the fact is we still do not know what's in it. Mr. Speaker, my constituents want to see this law repealed. I think it's bad policy, bad politics, and terrible for health care in America. I've supported every effort to end this law, and I will continue to support these efforts as long as I am in office. Fundamentally, I do not believe that this law will ever be ready. So next year, if the President has not worked with us to delay it or replace it, we'll be back to argue for an additional delays on both the individual mandates and the employer mandates. I will continue to demand that Congress and the President repeal this law and replace it with one that puts patients first, allows new and innovative paths for care and coverage, and does not put the government between patients and their doctors. And I yield back.
Gentleman yields back.